Dr. Muhammad Munir. He's a virologist at Lancaster University in the UK. Thank you so much, Doctor, for joining us here on the News Hour. Now, as we've just spoken with Simon there, Omicron cases are starting to appear in the UK and in various countries across the globe, which experts say are going to cause another wave of this pandemic. And it's great that governments are boosting their vaccination campaigns, but even that won't stop another wave from happening. How prepared do you think health systems are this time round?
You're absolutely right. I think the Omicron transmission rate is enormous. I mean, 2 weeks before in the UK, we have at 90% to 99% of the cases belonging to Delta variant. And since the end of November until now, we have around 20% of the cases in the UK belonging to the Omicron variant, with 90% of the population vaccinated. And in London region, it's even more than that. So in next couple of days is going to be the most predominant variant in the UK, and that situation isn't changed in many other countries where it is already ramping up. So the transmission is extremely high for the Omicron. In terms of healthcare preparedness, I think every healthcare sector in the world is already overwhelmed because not only just for COVID-related cases, but also non-COVID-related cases, and those being onto the waiting list, and there is a big backlog that need to be covered. So in every situation, any case number increases and hospitalization requirement increases, that would be certainly a burden onto overwhelmed already healthcare sector.
Right, and there was a lot of misinformation and fear when South African health experts came out and revealed this new variant of COVID-19, and we already know that one person in the UK has died that was diagnosed with Omicron. What can you tell us of what we know about this variant and how it differs from COVID-19 and its other variants?
Oh, absolutely. I am a part of the WHO expert panel, and we do discuss all of these questions on a daily basis. Since the identification of Omicron, we had now quite a bit of information about its transmission rate. We do know that it's 2 to 3 day is a doubling time, and we do know that the chances for somebody who's vaccinated is 3 to 8% more likely to be reinfected with this variant. So it is escaping the immunity. But one thing that we don't really have yet clarity is about the severity of the disease. And that is very difficult to address because we have no any country as like a naive population. And we don't have a country where there's a fully covered community from children to different cohort and age group. So severity is something that's going to take some time before we would have a full clarity on that. But as it stands now, it seems like the severity of the disease is relatively less compared to other variants.
Right, and Austria has made vaccines mandatory for adults starting February of next year. The EU Commission President has already called for a debate on mandatory vaccines, and Germany's new Chancellor Olaf Scholz has also voiced his support for vaccine mandates. Do you think vaccine mandates are the solution to defeating this pandemic?
I think what we need to really look into how much is the vaccine coverage, because that is the most powerful tool to put a barrier against transmission of these infections. And we do know that incentivizing people is certainly that encourage them to take up the vaccine. In terms of the vaccine pass and making it mandatory, we do know that in many occasions, for example, when France put the mandatory requirement for the vaccine coverage, 1 million people signed up for the next day for the vaccine. So certainly there's some sort of restriction onto the movement of unvaccinated people is going to be practiced now or later to really emphasize onto the fact that vaccines are the powerful tool.
All right, Dr. Muhammad Munir, thank you so much for joining us here on TRT World.